Hello, Sterile Processing Universe, and welcome to another episode of Real Talk with Bob Mars. I am super excited to be here with you today. And in our Did You Know series, I wanted to ask the question, did you know that the majority of the administrators out there don't truly understand the mission of sterile processing? And when I say administrators, I mean everyone with an O after their name. A lot of them understand that sterile processing is a cost center. It is not a revenue generating center. They also understand that the sterile processing staff might be washing dishes, for lack of a better term. I've heard that too many times to talk about. But now that we know this, it's really, really important as SPD leaders that we educate our administrators on exactly what we do in sterile processing and the complexities related to the tasks that we are performing, that we truly play a role in patient safety and infection prevention. If we don't do our job right, patients can be harmed. And we have to figure out a way to help them understand that. And one way that I absolutely recommend is inviting your O's or your administrative team down to sterile processing for a tour. Not to spend 10 minutes in the department, but to truly take a tour to look at the decontamination area and understand just how difficult it can be in that area, how hot it can be, and how challenging the work can be. To go over to the assembly side to understand why you need specific tools to inspect the surgical instrumentation before it goes into the containers. Also, the sterilization modalities. Do they understand high and low temperature sterilization and what they mean in the implications of not sterilizing devices properly and not following the IFUs? And speaking of IFUs, do they really understand the challenges that you face regarding IFUs, the manufacturer's instructions for use? And I don't just mean the instruments, I mean the chemistries, the equipment, the instrumentation. There are thousands that we're expected to follow, and every day it is a true challenge. So if you have not done so, I want you, sterile processing leaders, to stop what you're doing, go to your administrative offices, meet with your administrators, and tell them how important it is to come down and tour your sterile processing department so they can better make fiscal and leadership recommendations in your department based on what they have seen rather than what they think they know because they've never been in the department before. This is so very important. And now more than ever, we need leaders that are going to step up and that are going to challenge their administration to make their way to sterile processing to truly gain an understanding of what we do and just how difficult this task is that we have been dealt. So again, stop what you're doing, go to administration, and make it happen. I hope you have a fantastic day. This has been Bob Mars with Real Talk.